Traumatic brain injury recovery.
It's an ongoing process to make sure that families who are in need of services get the services that they need.
So what advice do you have for families, and what advice do you have for healthcare providers in dealing with these behaviors?
The best advice I would give to families is seek support. Don't do this alone. Here in San Diego, where I am, we have an organization called the Southern Caregivers Resource Center. They are a great resource for people who are finding themselves suddenly in a caregiver role. The San Diego Brain Injury Foundation. There are brain injury courses at local community colleges. Don't try to do this alone. Join a community of people who have already gone through this and can help walk with you through the process. Learn about brain injury. The more you understand why the individuals around you are acting the way they are, the less scary it is. So educate yourself through podcasts like this and through lots of online resources. I think that doing that really does help keep families from becoming isolated and despairing over their circumstances.
Good advice, Paul. How about for healthcare providers?
Patients, again, be aware and be educated. Oftentimes, when our folks have to go into the hospital system because they're sick, they're ill, it is easy for people in healthcare to look at our folks, our brain injured folks, and just be simply at sea. They just don't know. They are completely befuddled with regard to what to do with individuals with brain injury. So I think anything that has to do with more education for healthcare providers with regard to what brain injury looks like, what some of the consequences of brain injury are, and understanding that you can, even within healthcare settings, create environments that can support people with brain injuries and reduce the frustrations and challenges that lead to behavior problems.
Good advice again.
Please like, subscribe, and comment on this video.